Ladies and gentlemen, online viewers worldwide, welcome to the 2020 Tung Prize Laureate Lecture in Biopharmaceutical Science. 2020 was a year marked by unprecedented challenges brought about by the COVID-19 pandemic. While the pandemic has put most things on hold, our endeavors in gathering the Tung Prize laureates in biopharmaceutical science to highlight the importance of groundbreaking research and innovation in biopharmaceutical science have not been reduced. Now, please join me to welcome Dr. Zhang Wenchang, Chair of the Tung Prize Selection Committee for Biopharmaceutical Science, to introduce the 2020 Tung Prize laureate. Dr. Zhang, please.
It's my great honor to introduce the three laureates of the 2020 Tung Prize in Biopharmaceutical Science to you for their contribution to the development of cytokine targeting biological therapies for the treatment of inflammatory diseases. Doctors Charles DiNarino, Mark Federman, and Tadamizu Kishimoto. The third laureate, Dr. Tadamizu Kishimoto, received his medical degree at Osaka University, and now he is a professor at the same university. He is a pioneer in cloning IL-6 and its receptor. He also developed an inhibitor antibody, Actemra, against the receptors. Taking basic research and translating it into clinical practice, Actemra has been approved in the treatment of several immune disorders, including rheumatoid arthritis. This drug was also approved for the treatment of CAR T-cell-induced cytokine release syndrome. In June of this year, the US FDA issued an EUA for Actemra for treatment of hospitalized COVID-19 patients. The contributions of Dr. Kishimoto include basic discovery, drug discovery, and clinical translation. Let us welcome Dr. Kishimoto.
Thank you very much for your introduction. A title of my awarding speech is Interleukin-6, from Arthritis to CAR-T and COVID-19. It is indeed my great honor that the very prestigious Tung Prize is given to my life work on interleukin-6. We discovered IL-6 almost half-century ago as one of molecules inducing antibody production. However, at present, most of people know that this molecule plays important roles for various autoimmune diseases such as rheumatoid arthritis, and now an unexpected result is IL-6 may be involved in cytokine storm induced by COVID-19. In this lecture, I will present my life work on IL-6 extending for almost half-century from its discovery to very recent IL-6-induced cytokine storm. In 1960s, the presence of T cell and B cells were discovered in immune system. B cell produce antibody, but the presence of T cell is required. So I speculated that T cell produce certain molecules which stimulate B cells to antibody producing cells. And this molecule was finally isolated and cDNA was cloned, and it was called interleukin-6. And after cloning of IL-6, using cDNA recombinant molecules and antibodies, result shows that this molecule is very pleiotropic molecules. This slide shows that the transgenic mice with IL-6 cDNA. You can see that the tremendous growth of B cells. You can see that the growth of spleen and lymph node. If we make IL-6 deficient mice, then when we infect anti-vesicular stomatitis virus, then antiviral response is very much decreased. Same as in inflammation. If we inject turpentine oil, then the inflammation occurs. But in the absence of IL-6, inflammation is much decreased. So that IL-6 shows both responsible for both IL-6 antibody production as well as inflammation induction. So many studies have been done with IL-6, and it has shown that IL-6 act on B cells and produce antibody production. It also acts on T cells and induce differentiation on Th17 cells. And it acts on liver cells and induce hepatocyte-stimulating factor and induce C-reactive protein, fibrinogen, serum amyloid protein, heptidin, and reduce albumin. It acts on bone marrow and induce karyocyte differentiation and induce the increase of platelet. It acts on the synovial fibroblasts and induce rank ligand and differentiation of osteoclast and involved in bone absorption. It is a potent growth factor for myeloma, plasmacytoma cells. So, and many other results, liver cells and skin cells, such kind of result. IL-6 shows that a very wide pleiotropic function. Then question is why IL-6 can show such a wide variety of function. We isolate receptor molecules against IL-6, and we isolated 80 kilodalton IL-6 receptor. And this, interestingly, this molecule does not have a long intracytoplasmic portion, does not have signal transducing molecules. And we found that bind of IL-6 with IL-6 receptor induce another signaling molecule, we call GP130, which we also isolated. And IL-6 interaction induce a dimerization of GP130. And signals can be transduced through GP130. And this signaling called classic signaling. And another is that soluble IL-6 receptor is present in the serum. And the IL-6 soluble IL-6 receptor complex bind with GP130 and induce dimerization and induce signal transduction. And the GP130 express every place, every cells, so that the IL-6 can show that the wide variety of biological function. And IL-6 receptor binding induce the dimerization of GP130. And the dimerization of GP130 induce JAK tyrosine kinase activation and then followed by STAT3 activation. And the STAT3 moved into nuclei and induce various gene expression. So we elucidated everything from IL-6 receptor, GP130, and signaling molecule, transcription factor, STAT3, and everything was discovered by our groups. Then we discovered overproduction of IL-6 as involved in various diseases. Such as cardiac myxoma, Castleman disease, rheumatoid arthritis, systemic onset of juvenile idiopathic arthritis, various autoimmune inflammatory diseases such as Still's disease, progressive sclerosis, reactive arthritis, polymyalgia rheumatica, aortitis, giant cell arteritis, neuromyelitis optica. So in order to treat these inflammatory disease induced by overproduction of IL-6, we try to block the IL-6 signals. So we prepared antibody against 80 kilodalton IL-6 receptor. Then the IL-6 receptor can block IL-6 receptor and IL-6 binding. Also, antibody neutralize soluble IL-6 receptor and inhibit trans signaling. So all IL-6 signaling are blocked and try to treat the patient. And this anti-IL-6 receptor antibody humanized is, and now it's called Actemra, or generic name tocilizumab. And it was widely used all over the world, more than 100 countries. First case is this molecules applied, this antibody is applied to the treatment of Castleman disease. And this patient showed that the multiple lymph node swelling and high fever every day. And we treat with anti-IL-6 receptor antibody, Actemra. And then fever went down. And C-reactive protein went down to 0. And anemia recovered. This showed the C-reactive protein went down to 0. And the serum amyloid protein went down. Hemoglobin went up. Albumin went up. And the IgG went down. And the cholesterol went up. And the multiple lymph node swelling disappeared. So that completely recovered from this is first case. And the next case is juvenile idiopathic arthritis. This patient is 6 years boy, suffered from high fever every day, and joint pain, swelling, and skin rash, hepatosplenomegaly, and his height did not increase at all. And after treatment, 18 months after treatment, all symptoms disappeared, and he enjoyed swimming in sea. And his height increased 18 centimeters in 18 months. And this picture was taken when he was high school student, and he was completely healthy, and his height is high. And a large scale of clinical trials, international trials has been done, and very good result, and published in New England Journal of Medicine. And at that time, editorial board said, a new era in the treatment of systemic juvenile idiopathic arthritis. Next case is very common disease. rheumatoid arthritis. Synovial tissues of joint produce constitutive production of large amount of IL-6. And in the experiment in mice, we induced collagen-induced arthritis. And you can see that the very strong inflammation in joint, massive infiltration of inflammatory cells, and destroyed cartilage. And the joint is completely destroyed. And here B, picture B, in completely normal. Same experimental procedure, collagen-induced arthritis, but no joint inflammation. What the difference, A and B? B is IL-6 gene deficient mice. So this result clearly shows that IL-6 is essential in the induction of collagen-induced arthritis. So we applied for this antibody for the treatment of rheumatoid patient. As you can see, morning stiffness, pain, and swelling disappeared, and C-reactive protein and fibrinogen went down. And large scale of phase 3 trial, clinical trial, has been done in all over the world, 40 countries, 4,000 people. This result is the Japanese clinical trial completed in 2005. You can see American College Rheumatology, 20% improvement, 50% improvement, 70% improvement. Very significant improvement compared to the DMARD, control DMARD. And you can see bone absorption and joint destruction is prevented. Control patient treated with DMARD trials, bone absorption and joint destruction, you can see. So that treatment with anti-IL-6 receptor antibody can prevent that joint destruction. If you culture peripheral blood mononuclear cells with synovial tissues, then that you can induce osteoclast ligand, red colors. But in the presence of Actemra, anti-IL-6 receptor antibody, this induction is inhibited. And long cultures, normal cultures, you can see that the induction of osteoclast, large nuclear osteoclast, but in the presence of antibodies, no osteoclast formation, so no bone absorption. So all results show the blockade of IL-6 signaling effective for treatment of RA group of autoimmune disease. Then the question is, how is IL-6 production regulated? Why overproduction occurs in the chronic inflammatory diseases? Then we found two molecules, ARID5A and lignase. And both two molecules bind to 3' untranslated regions of IL-6 messenger RNA. And lignase bind to the stem loop of untranslated regions and degrade the IL-6 messenger RNA, so inhibit IL-6 production. But ARID5A compete with lignase and also bind to stem loop, and it stabilizes IL-6 messenger RNA, so induce overproduction of IL-6. So when ARID5A bind to IL-6 messenger RNA, 3' UTR, untranslated regions, then 3' UTR, untranslated regions, then IL-6 messenger RNA, 3' UTR, untranslated regions, then 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 3' UT IL-6 message stabilize and overproduction of IL-6 and stimulate IL-6 receptor, and again IL-5A production and overproduction. These positive circles induce overproduction of IL-6. As shown in this slide, if you give the endotoxin, lipopolysaccharide into mice, then all mice die 4 days. So the LPS induced septic shock. But anti-TNF antibody did not show any effect, no prevention. But anti-IL-6 receptor antibody, Actemra, could inhibit induction of septic shock. So not only chronic inflammation, but acute septic shock also inhibited by the inhibition of IL-6 signals. And IL-5A complete knockout completely inhibit, prevent septic shock induction. So without IL-6, no septic shock, no cytokine release syndrome in mice. And this is not only in mice, also in humans. IL-6 inhibit cytokine storm, cytokine release syndrome. This is the first case, 2012, chronic CAR T cell therapy. This 6 years girl suffered from B-cell leukemia, and Professor Carl June's group applied the CAR T cell therapy. This is the first case. And CAR T cell therapy, as you know, that the T cells are chimerized with antibody binding site, antigen binding site, so that the T cells recognize tumor cells and attack tumor cells, and activated T cells proliferate and release large amount of gamma interferon and activate macrophages. Macrophage produce large amount of IL-6, and then patient shows cytokine storm or high fever, blood pressure went down, such kind of things. But anti-IL-6 receptor monoclonal antibody could rescue this CAR T cell therapy induced cytokine storm. This is the New York Times shows 2012, this first case, her level of one of the cytokines, interleukin 6, had shot up 1,000-fold. So that the very much increase of IL-6. So they try to treat patient with anti-IL-6 receptor antibody. And the doctor said the response was amazing. Within several hours, shock recovered and fever went down. And then IL-6 went down, C-reactive protein went down. All abnormal situation recovered. And she completely recovered from the septic shock, cytokine release syndrome. And since then, many CAR T cell therapy was done together with after side effect was recovered by the treatment of tocilizumab. And we measured cytokine profile of various cytokine release syndrome patients, such as sepsis or ARDS, acute respiratory disease syndrome, or burns. And in all cases, almost 100 cases, IL-6, IL-8, MCP1 increase, very much increase in sepsis, ARDS, and burns. And interestingly, plasminogen activator inhibitor also increase in sepsis, ARDS, and burns. And 2020, in Wuhan, COVID-19 patient comes out, and these patients, severe COVID-19 patient, shows that the high level of IL-6 production and cytokine release syndrome and pneumonia. And so they treat with tocilizumab. And almost all patients rescued, recovered. Since then, many clinical trials, large-scale clinical trial has been done, and 2,000 of cases, significant result, significant beneficial effect has been observed by treatment with tocilizumab. Rescue, decrease of death rate, and hospital stay days. And this is recovery test preliminary result of 5 randomized controlled open label platform trials, and significant reduce of death and significant beneficial effect together with dexamethasone. And since then, that many clinical trials have been done, and the patient treated with Actemra, anti-IL-6 receptor antibody, and dexamethasone, and rescue that severe COVID-19 patient. So FDA authorized Actemra as COVID-19 drug. In the very early stages, we also tried, this is not so many patients, but still IL-6 increase and IL-8 increase, MCP1 increase. And in all patients, plasminogen activator inhibitor increase. And we tried with anti-IL-6 receptor antibody. Before treatment, IL-6 high rate, MCP1, IL-10, and the plasminogen activator inhibitor at the increase. And after treatment, C-reactive protein went down to 0. And IL-6 is anti-IL-6 receptor antibody, so nothing decreased, but PI1 decreased, and patient rescued. When I measured IL-6 level of serum, it's not so much increase compared to ARDS or CAR-T-induced cytokine release syndrome, 100 times less than these diseases. So in COVID-19 patient, IL-6 increase is not so high, but serum plasminogen activator inhibitor 1 is increased in all COVID-19 patients. So we speculate virus or virus product attack to the endothelial cells, vascular endothelial cells, and induce various cytokine and PI1 and induce cytokine storm. So we in vitro study, we tried in vitro studies with human endothelial cells and stimulate with IL-6, soluble IL-6 receptor, because human endothelial cell, vascular endothelial cell, not express IL-6, so that the complex we stimulate and increase of IL-6, IL-8, MCP1 in human vascular endothelial cells, and tocilizumab, anti-IL-6 receptor antibody, decrease the levels. and by 1 also increase and decrease. So that we conclude that coronavirus SARS-CoV-2 attack human vascular endothelial cells through toll-like receptor Ho and produce IL-6. And IL-6 induce various cytokines as well as plasminogen activator inhibitor 1. And this induce a coagulation in blood and also vascular leakage and induce cytokine storm and very serious COVID-19 disease. And anti-tocilizumab inhibit IL-6 function, so inhibit by 1 induction and rescue the people. And this is the milestones of our very basic studies and application into clinical studies. We cloned IL-6 1986, then cloning of IL-6 receptor 1988, and transcription factor NF-IL-6 and signal transducer GP130, and cloning of STAT3 signal transducer, suppressor of cytokine signal, and recently regulation of IL-6 production by regulase and IL-5A. And this very basic studies was applied to the clinical trials. We found that overproduction of IL-6 in myxoma, rheumatoid arthritis, Castleman disease, and juvenile idiopathic arthritis, and applied trial to treat these patients. And 2005, Castleman disease was approved for the treatment. And 2008, rheumatoid arthritis and SJIA in Japan, and 2009, rheumatoid arthritis in EU, and 2010 in USA. And now, and then that rheumatoid arthritis is approved more than 100 countries. And now more than 1 million people are treated with anti-IL-6 receptor antibody tocilizumab. And recently, giant cell arthritis is approved, and Takayasu arthritis. And now CAR T-cell induced cytokine release syndrome was side effect was treated with anti-IL-6 receptor antibody. And now COVID-19 induced cytokine storm is FDA approved, so that many diseases are treated with anti-IL-6 receptor antibody. So very basic studies as applied for the treatment, very, very important diseases, and more than 1 million of people are treated with this antibody. And this picture was taken 1990s when we cloned IL-6 receptor GP130 signal transduction and completely evaluate signaling method of IL-6. And then I moved to clinical field. And this is today's papers in immunology frontier research centers. So that I overviewed 50 years my trials and my studies on IL-6 from very basic studies to clinical trials. And I already 82 years old. Thank you very much. I'll finish here.
Thank you, Dr. Kishimoto, for continuously pursuing new discoveries in the field of biopharmaceutical science and for significantly broadening global knowledge, especially at a time when the pandemic has created so many obstacles. Ladies and gentlemen, This concludes the 2020 Tung Prize Laureate Lecture in Biopharmaceutical Science. Thank you all for joining us today. Please stay tuned for the announcement of the 2022 Tung Prize Laureate in Biopharmaceutical Science.